If you don't mind, I'm going to start recording you. Is that okay?
That's fine.
All right. Can you state your name and your title for me?
My name is Dr. Margo Erme, Medical Director, Summit County Public Health.
With the recent outbreak of Listeria, it's been in cantaloupe, and now we're seeing it in lettuce. Can you tell us what exactly Listeria is?
Listeria is a bacteria that mainly occurs in soil. It can occur in water, mud, livestock food, silage, which is used for feeding livestock. And we've typically have seen it in the past on recalls with foods that had some dairy base to it, like soft cheeses, unpasteurized cheeses. And over the last couple months, we've had some food recalls for produce. In September, it was for cantaloupe, and just the recent one for lettuce.
What is the cause of Listeria? Getting into these foods.
Well, like I said, it is an environmental organism. So our foods aren't produced in sterile environments. Food grows in dirt. Cattle walk around in the environment. So there's a lot of potential for contamination. Now, how it exactly got onto the cantaloupe or onto lettuce is a source of research right now.
What are the symptoms that somebody can get? Is this deadly if someone were to get contaminated with this?
Well, if somebody is infected and you get it from ingesting a product that might have Listeria on it, there are groups that are more likely to get sick, and those are the very young, like newborns, pregnant women, immunocompromised, elderly, people who are alcoholic that have liver problems, people that are diabetic. And while Listeria can cause just a very mild illness, we typically think of it as an invasive disease. It will cause systemic symptoms, including meningitis. And one of the problems with it is that it can, as opposed to some of the other foodborne illnesses that we're used to looking at, salmonella, even E. coli, this one does have a more potential chance of causing serious illness, hospitalization, and even death because it tends to be more severe in those very susceptible populations.
What would you tell somebody to do if they think they've eaten something that was contaminated with Listeria?
Well, there is no prophylaxis. There's no vaccine against it. There's no medications that you can take. For the majority of people, they're not going to get sick at all. But we cannot pinpoint who would get sick or who wouldn't. And the incubation period, meaning the time that somebody would ingest or eat something that might have Listeria on it and the time they can get sick, is really variable. It can be as short as 3 days. It can be as long as a month and a half. So it is not like some of the other foodborne where you eat it and then 3 days later you develop the vomiting, diarrhea, abdominal cramps. So what we tell people is that you really need to be very watchful for symptoms. And the biggest symptoms we tell people with are things such as fever. They have signs of meningitis, which is severe headache, stiff neck, problems with their vision. So they need problems moving their arms or legs. So they have to look for those, nausea, vomiting. And if they have a concern, then they definitely need to speak to their physician. This is not, it has to be diagnosed basically through a blood test. So it's not that somebody can go to the hospital right now because they ate lettuce and want to get tested for it, because it doesn't work that way. It could only be picked up when someone actually has symptoms. The other thing to tell people is to look at the food recalls, and if you do have any of the foods that are recalled, then don't eat them. Take them back to the store, throw them away. But you also have to realize that the recalls tend to be limited to specified products. So it is not all lettuce. It is not all cantaloupes. So people do need to be very much aware of what food they purchased, where it's from, and what the recalls say. But if people have any questions about their health or concern, then they definitely need to speak to their physicians.
Do you know if Listeria is one of the deadliest outbreaks that the U.S. have seen?
The Listeria with the cantaloupe was, if you looked at the number of people who died compared to other foodborne outbreaks, has been one of the deadliest ones. Now, I don't know yet if there's been any cases of Listeria, or I haven't seen if there's been any cases of Listeria that have been associated with the lettuce, only because I haven't had a chance to check, or whether the recall was generated because they actually identified the Listeria through testing of the lettuce. So I don't know about what's going on with the lettuce recall yet.
Mm-hmm. And why do you think we've seen it pop up recently within cantaloupe and lettuce, and all of a sudden within, a couple weeks of each other?
Well, one of the things is that things are being tested, and it's amazing. There's a lot of recalls that are issued with nobody ever getting sick, because products do get tested, and they may get recalled before people get sick. But as to what the reason is that we're seeing the Listeria in produce this year, I think is a subject of some scientific research. Is there changes in the environment? Is there changes in agricultural practice? Was there related to the particular climate we had this year? I think that question is still out there to be answered.
Okay, thank you. I really appreciate your time, Doctor.
You're very much welcome.
All right, I hope you have a good day. Thank you for your help.
You too. Goodbye.
Bye.